Christmas is on, for now, after reports this morning that Boris Johnson is going to rule out further festive COVID restrictions. However, with Omicron cases gripping the nation, do we need further restrictions to prevent a New Year surge?
An exclusive Survation poll for Good Morning Britain has revealed 6 in 10 people are worried about another lockdown. 50%
of people said they won't adapt their plans due to the new COVID variant.
And 60% of people support a COVID-19 booster mandate.
Goodness.
Wow, that's quite shocking.
That's high.
Yeah.
I mean, a mandate would be you have to have the booster, otherwise we'll fine you.
Effectively make it illegal not to have the booster.
Yeah.
I struggle with that personally. I struggle to legislating over someone's back.
I know, I think encouragement rather than mandating.
But 60% of people, I wonder if people... I'd like to see how the question was phrased, if I'm really honest. Maybe someone can get that to me and we can tell people what the exact question was on that. Joining us now is Dr. Dan Goyal, an NHS consultant who's working in COVID wards, who wants an immediate circuit breaker. Professor Devi Srihar, the chair of the Global Public Health at Edinburgh University, who thinks a circuit breaker will just push the problems down the line. And nightclub, or night bulb, as it says on my auto cue. Nightclub. I presume you owned a nightclub, not a night bulb, Terry George. And Terry says Christmas earnings are vital, but having a circuit breaker would just be postponing the inevitable. OK,
well, let's start with Dr. Dan Goyal, because you are an NHS consultant in high dependency and COVID wards. You see right on the front line the consequences of having restrictions or not having restrictions. What would you like to hear from the Prime Minister?
Thanks, Susanna. Yes, I mean, I'm not arguing in favour of circuit breakers, but I certainly think they should be on the table. COVID-19 at the moment is really overwhelming the NHS. It's taken up 70% of our winter contingency beds. It's causing triple the amount of deaths that we normally experience from pneumonia. And Omicron only looks set to worsen that. We have had 2 years to prepare for it. Our bed capacity is less than it was in 2019, and we still don't have formal follow-up and triage systems for COVID patients. So unless we mitigate and unless we expand the healthcare capacity, a lockdown seems almost inevitable, really.
I just wonder whether, when we just read out those survey results, 60% of those that we surveyed said that they would support a mandated booster. Is that something that you would support? Because we know the booster is very effective, for instance, against Delta.
Yes, I mean, we were seeing with Omicron that hospitalisation rates look about the same, but that is in a mostly unvaccinated population. And it does look like there is some protection over previous immunity to ICU. It's still very preliminary data. But as effective as the boosters will be, particularly for the vulnerable, particularly for the adults, I think I would be really against mandating this to the general public. What we need is to be able to trust our leaders. We need good examples from our leadership, and we need to be able to follow their advice. And that advice needs to be consistent and consistent with common sense, really.
Devi Srihar, if I can come to you, one of the things that was just said there is Omicron is set to make things worse. But we heard coming out of the States yesterday that's not necessarily true. I mean, it seems to be it's more transmissible, which means it could displace the Delta variant in the UK. But the big question is, how does it affect people's health? There is a chance it could actually be less dangerous than Delta, therefore replacing Delta might be a good thing, isn't that?
I think we just don't know that yet, and it's a real gamble for countries just to hope, like they have from the start, that this will be less worse on their health systems. I think we have to both listen to people like Dr. Dan, as well as people who are, at the front end of having to run businesses, to say this is a serious challenge. We need to get through the winter period without the NHS collapsing. We know businesses are needing to survive as well. We want to have these businesses at the end of the pandemic. So how do we work together? And I think if we do use our vaccines, we know vaccines are very effective against severe disease, try to get more young people vaccinated, explain to them the protection to themselves of getting vaccinated. Even if you're in your 20s and 30s, you can end up seriously ill in hospital, as well as the home testing, which means people can catch themselves if they're infectious and make sure they don't go infect their family members and co-workers.
Terry George, You run nightclubs and bars. If the government announces restrictions, you must be very nervous about this, your most important time of year. So have people been changing the numbers that they're inviting, for instance, to Christmas parties? Have they required testing? Are they cancelling? What's the situation in the hospitality industry?
I think you've got the wrong guest. I own a light bulb shop. I think you've called up the wrong person. Joking. Who is it?
That's a bright spark.
No,
yeah.
On a serious note, no, of course, this is the time when we earn like 25% of our turnover. So it's super important for us. If we have a break now, if anything happens, if any disruptions come, then it's going to be a huge impact on our businesses in the hospitality industry. And we really can't have this happen. I feel that from my point of view, and I look at this from a personal point of view as well as the industry as well, we've done what the government have asked us. We've had our vaccinations, we've followed the rules. We've struggled onto our businesses by a thread, really. So I think that we just need to kind of live with it, be sensible, keep doing the things that we have been doing, and we just can't expect to be living with another lockdown of any sort, because it's just going to cripple the business.
Interestingly, I've now got what that survey question actually was, which is, to what extent would you support or oppose a COVID-19 booster mandate requiring proof of a booster vaccine in order to enter public places such as bars and restaurants? So it's less of a mandate, it's more a vaccine passport would be. So 60% of people are supporting vaccine passports to go into nightclubs. So how do you react to that? As a nightclub owner, would you support that?
If it means that we keep going, then yes, I would support it. I've been to Greece, for example, and you can't even go and sit in a cafe without having to show your vaccine passport, and it works. But I do know there are people, including my sister, who has been, she's had a reaction to her first injection. She can't have the second one. And there are people who can't genuinely have the vaccination. What do we do with them? Because there's nothing that's come out yet that says how we support those people and how they can go about their daily life.
Let's put that to Professor Devi Sridhar. For those who have either had a bad reaction, and we know that, a number of people who've had the booster have had I had a little bit of a reaction and didn't feel 100%, 24 hours. That's something I just took into account. But how do we deal with people who are still hesitant about the vaccine or unable to have the second dose or the booster?
Well, if we look at other European countries, Greece, Italy, France, Germany, what they have been doing is saying a negative test is also a way to get, let's say, certified to go into indoor spaces. So I think it's a mix of using testing for those who are a bit nervous about vaccination or for medical reasons can't be, as well as being fully vaccinated. And I think this is a really constructive discussion. We need to find a way to say, rather than full shutdown, how do we stay open, but stay open using testing and vaccination, something we didn't have last winter.
And it's rather interesting because at the start of the pandemic, way back when, your voice became quite prominent as one of those people asking for more restrictive measures, more shutdown, more protection. You're now arguing from a different perspective. What's the difference? Obviously, it's the vaccine. Do you think we've passed the point where this becomes endemic rather than pandemic?
No, it's still a pandemic. I think still it's causing a lot of disruption across the world. But I think what changed is when this virus emerged in January 2020, there was a chance for countries to buy time for a scientific solution. Remember, we didn't have testing, we didn't have vaccines, we didn't have therapeutics. Doctors didn't know what they were facing when patients were arriving in hospital. They were like trying to get information from Chinese and Italian colleagues for how to treat even COVID patients and learning on the go. So if we look to where we are today, we know vaccines protect against severe disease. We know that actually testing can work, breaking chains of transmission, so we can keep people circulating, just keep pulling out those who are infectious so they stay home and don't infect others. And we get better and better therapeutics, hopefully new antivirals by the spring from Merck and Pfizer. And doctors as well have gotten better and better at actually how to treat these patients, understanding the course of action. So in a way, we bought time for science to deliver solutions. Now the solutions are here. We have to find a way to use them to manage this serious issue, but also manage the harms to society of complete shutdowns.
Very, very briefly, if there were to be a 2-week circuit breaker, would that not just push the problem down the line and mean even bigger risk in January and February?
Yeah, I think
I can see
the
doctor shaking his head, but...
Sorry, Dee, yeah, I didn't mean to cut in on you there. I mean, we are at a very critical time in the NHS, and we need our winter beds, and Omicron's going to challenge that. We've already lost so many to COVID, and I absolutely agree that we have had time to prepare, and we could be doing much better in the UK. The UK just hasn't done enough. It hasn't prepared the NHS frontline enough. People aren't making the right choices. If you want a free Christmas, wear a mask. Limit your interactions just now. As Deepti says, take your lateral flow test when you go out. There's a lot more that we could be doing that we're not doing. And I'm afraid, as much as everyone likes having fun and going out and livelihoods depend on it, actual lives are depending on this. The level of death and disability that we're seeing is beyond comprehension.
Okay.
And we do need more capacity if you want to avoid lockdown, I'm afraid.
Okay. Thank you. We're glad we have the opportunity to give you a voice on here, all of you. Thank you very much for joining us.
Yeah.